Good morning, everyone. My name is Rachel Tidman, and I am the Global Rabies Coordinator at the headquarters of the World Organization for Animal Health. I'm very happy to be presenting to you today on the global control efforts to minimize the burden of rabies. So I'd like to just start with this idea of the global and regional burden of rabies. So globally, rabies continues to be a priority zoonotic disease, threatening public health in approximately 150 countries. We estimate that it's about 59,000 human deaths every year, but the reality is that this is likely an underestimation due to ongoing and chronic underreporting of cases. Particularly tragically is that this disease is fatal in almost 100% of cases, despite this being a disease that is entirely preventable when people have access to human post-exposure prophylaxis, education about rabies, and if we also vaccinate our dog populations, as 99% of our human rabies cases come from dog bites. In addition to this significant impact on human life, we also see a heavy economic impact from rabies, both from the loss of human life and cost of human post-exposure prophylaxis, but also through the loss of working animals, which directly impacts the livelihoods of people that rely on these. And the burden associated with rabies is carried mostly by our most vulnerable populations. In terms of a regional burden, the honest answer is that we don't have the information to really know. You can see here a snapshot from the World Health Organization Global Health Observatory on the reported number of human rabies deaths in some of the countries in this region. And a large portion of this data is simply no data about the number of human rabies deaths. And this is our most important indicator. So if we have no data reported on human deaths, then we're going to have very limited data on everything else. But we do know that this persists as a public health problem in the Middle East. In 2015, there was the adoption of a technical item on control of rabies in the Middle East. We spoke to you last year as well in the 2023 Regional Commission, which included recommendations on the importance of One Health for the control of zoonotic diseases, including rabies. And despite the differences between country progress, we also know from your feedback that there are some challenges that you share. An increase in dog bite cases, underreporting of rabies cases, lack of adequate resources to support dog population management, and limited implementation of mass dog vaccination. And these are not challenges that only face your region. These are shared challenges across almost all rabies endemic countries. The good news is that we already have this global strategic plan to end human deaths from dog-mediated rabies by 2030. We also have a lot of the tools and resources that we already need to tackle this. And we have experience from other regions and other countries to help us to draw upon, to help us progress towards this. Our global strategic plan was launched in 2018, helping us to crystallize this One Health approach that was needed to make progress based on these best practices from around the world. But this is a global strategy, and it really puts countries at the center. So it still needs to be very country-centric in order to drive this forward. So countries need to be developing their own national strategic plans in line with this global strategy in order for us to reach 0 by 30. So in 2020, the tripartite organizations, so WOA, WHO, and FAO, launched the United Against Rabies Forum. And the idea is that these organizations can provide strategic direction, make sure that we're still in line with international standards and recommendations, but also then bring on wider stakeholders across all sectors, human and animal health sectors, the environmental sectors, civil society, academic institutions, researchers, the private sector, try to really get these on board, all sharing their experience and knowledge, and help countries to develop and implement national control strategies for rabies elimination. The experts within this network help to develop guidance and recommendations in line with the international standards so that countries are able to implement these activities. And this forum also helps us to coordinate all these various stakeholders so that we can better support countries in the implementation of rabies control by aligning activities and reducing duplication and fragmentation of efforts. You can see here at the bottom our website, unitedagainstrabies.org. I'd really encourage you to go visit that. There are a huge number of resources and tools that can be used. And we are all very happy if you want to reach out to myself or any of the speakers at this event in providing some more information or helping you to connect to some experts that can help you use these resources. So now that we have this global goal, we have a global strategy, and we have a community of experts to help us implement activities to progress us towards that goal, then we need to know if we're actually making progress and achieving these key milestones. We have on the top here clear international milestones and processes to actually assess this progress. So through WOA and WHO, we have these things in place. This helps us to identify when countries have achieved kind of these key moments of success. We've also then developed the United Against Rabies Forum roadmap. And this bridges these international milestones with things like the SARE assessment, which you'll hear more about soon. So the SARE assessment provides more detailed, granular monitoring and evaluation of country work plans. That helps to really just bridge this SARE assessment and the international milestones. And countries can then identify whereabouts on this roadmap they are, what sort of activities they need to conduct in order to reach the next milestone, and then can help them link to various tools and resources that can help them carry out those activities. So using these milestones, I'm just going to go over some of the key concepts and resources that can help you as countries to implement your rabies control activities. Now, it's worth remembering that the milestone of the Global Strategic Plan, this milestone 4, is no human deaths from dog-mediated rabies by 2030, sorry. So this is the global goal, and this is only achieved when countries submit an application to WHO and can prove that they have 0 deaths from dog-mediated rabies. But this is not the end goal for countries. We're reducing the public health burden, but there is still a lot of work to go to maintain and to go further to eliminating dog-mediated rabies transmission or elimination of the rabies virus in both dogs and wildlife. Our first milestone along this pathway is building evidence. And I want to come back to that very similar picture that I just showed you a couple of slides ago. Here on the left, we have a snapshot of the Global Health Observatory of the World Health Organization. On the right, we have the World Animal Health Information System of WOA. And you can see that throughout those, we have these small gray squares. We have a lot of squares that say no data at all. And this lack of data is really significant, and it's at all levels. So this is a picture of international level data, but it often extends through to both national and local level as well. And we have issues both with inadequate data, but when this data does exist, it often exists in silos. So instead of being shared with the stakeholders that need it to inform their program, it's often just kept in one sector and not shared across sectors. And the problem with this is that without reliable data, we will struggle to advocate for political will and for investment for rabies control. We'll also struggle to understand which aspects of our control programs are being impactful and which areas need to be improved. And overall, we actually won't know if we're progressing. So we're going to be putting effort into rabies control without knowing if we're actually being successful. So to build this evidence, we need to improve field level data capture, improving our laboratory and diagnostic capacity, but we also need to make sure that our systems and sectors are talking to each other. So if we're capturing data in the human health sector, is this informing our animal health sector in identifying rabid dogs? If we identify suspect dogs, are we then following them up to track potential human exposures? We have experts available, for example, through the WOA Reference Laboratory Network for rabies. My colleague will talk to you shortly about that. We also have guidelines on which data at minimum should be captured at the national level. So if you are building this national control program, which aspects and which data should be captured at that level and reported upwards to be effective, and what's the bare minimum that you need to have. So we encourage you to look at this when you're developing or revising your control strategies. And when it comes to data sharing, who should this data be shared with? Well, this should be cross-sectoral. So it should go to the competent authorities, both human and animal health sectors that rabies control falls under in your country. And a really good way to help collate data from various stakeholders is to identify a clear national point of contact for rabies in your country that stakeholders from all sectors can go to, can contact, and that can help coordinate and share data across sectors. Again, we need to be making sure that we're capturing this data with a purpose in mind, so not simply for the sake of capturing data. But the data we're capturing needs to highlight that true burden of rabies. It should help in measuring progress and demonstrating where interventions are successful and where they're not. And in doing so, this data can help empower decision-making and inform where resources need to be allocated. You also then need to make sure this data is reported all the way from field level to national level and then up to international level to help us monitor this progress, monitor the epidemiological changes, and advocate for further investment and support for rabies control. And it's also worth just noting that there are some excellent tools that will help you with data collection and reporting. But using these tools does not mean that the data is reported to WOA and to WHO. So it is still the responsibility and the mandate of countries to then take this data and report it up to the relevant data collection sites. That is the World Health Organization Global Health Observatory for the health competent authorities, and for the WOA WIPIS for our veterinary authorities. Our next milestone is then the development of a national strategic plan. So we need to take all this data we've collected, even if it's limited, and then countries can start putting this into a national strategy for rabies elimination. This national strategic plan provides a framework with clear activities, roles, and responsibilities, and it brings together all the key stakeholders to contribute to rabies control in the country. Again, there are a lot of tools and resources that can help with this. So in particular, we have the template on the United Against Rabies website that includes example texts and tables and recommended key sections that should be included in a national strategic plan. When this plan is then finalized, and it should be signed off by competent authorities, both health and agricultural sectors or the associated ministries, we'd really encourage you to submit this to WOA for endorsement. So this process takes the National Strategic Plan, it provides a comprehensive review by rabies experts, and it means that we can provide expert advice on how this plan can be strengthened and improved to continue progressing towards 0 by 30, whilst also linking it to other experts that can help you implement parts of your strategy. Really importantly, it also means that we can get national and international recognition of the efforts that your country is going to, which can help us advocate and mobilize further resources to scale up efforts. My colleague, Dr. Manal Dapdadar, will give you more information on this shortly, but please feel free to contact us if you would like further information on this process. So at this point, we now have built the evidence in your country, we've established, we've implemented this national strategic plan. Now we need to scale it up to target the whole country. Again, we encourage you to get in touch with us. There are so many experts and stakeholders that can contribute, either in providing technical advice, through building capacity, or potentially other partners that are already actively contributing to specific in-country activities that we can help connect you with and align those and make sure that those resources are being used as impactfully as possible. You also have the WOA Vaccine Bank to help procure high quality, low cost vaccines for mass dog vaccination. And again, we'll go into more detail on that in the next presentation. We have various tools available in the United Against Rabies Forum toolbox to help you with program planning and scaling up. And we also have templates and the partnership map on our website to help you map out stakeholders that could contribute to your efforts. Throughout all of these processes, it's really important to remember that we want to highlight the successes and the progress, and also to share any challenges that you've had. So I would like to leave you with these 3 kind of next steps, depending on the progress that your country has in place. So does your country still have dog-mediated rabies, but there is efforts to put in a One Health, a national strategic plan for rabies? Then contact us. Let us know if you need help developing that or implementing parts of your strategy. If it's being finalized and being implemented and you would like to consider endorsement, then please contact us and we can certainly help you through that process. If your country has had 0 human deaths from dog-mediated rabies for at least 24 months, then we recommend health authorities in your country contact WHO in order to explore this process behind WHO validation. In the event that your country is free from dog-mediated rabies, then please follow up regarding self-declaration by the World Organization for Animal Health as well. Advocacy and awareness throughout this entire process will be hugely important. Your organizations are very welcome and encouraged to sign up to become United Against Rabies Forum members. We have quarterly webinars that are open access and provide a lot of information on various tools and resources and can help you connect with experts that can help you. We also encourage you to connect to the United Against Rabies Forum social media channels. This will help connect you to other stakeholders. You can share your experience and you can learn from experiences of other stakeholders as well. So thank you so much. Please do visit the website. Feel free to email me or any of our speakers today if you have questions. I'll pass over now to my colleague, Dr. Manal Daptardar, who will go into some more detail on the specific support that WOA can provide. Thank you very much.